Mark the 29th International Day Against Drug Abuse. The campaign, the International Day of Anti-Drug Abuse and Illicit Trafficking, is observed annually on June 26th since 1988. Now, this year's theme is Listen First. A march to declare war against drugs is currently underway in Durban. From the march, we are joined on the line by the head of Urban Futures Centre, Professor Monique Marks. Good afternoon, Professor. Would you please explain the Support, Don't Punish protest and advocacy event that is currently underway in Durban today?
Sure. So the Durban University of Technology, together with an organization called TB HIV Care Association, is running two events, one in Durban and one in Cape Town, which is part of a global movement which is called Support, Don't Punish. And essentially what we are advocating for is for support to be given to people who use drugs and their families, rather than a more punitive approach, which is currently the approach that we have, where law enforcement is seen as the way of dealing with problematic drug use, which doesn't help at all. It's just really expensive, and it also often, once people go into prison or are criminalized, they are even further marginalized from society, and they're even less able to normalize their lives for example, getting jobs or looking after their own children or eating properly and so on and so forth. But there are a whole range of support systems that could be put in place to assist people with normalizing their lives and to make drug use less harmful for people and for communities. So really, we are part of a broader movement, which is called a harm reduction movement, which is aimed at reducing the harms that drugs can and do cause. We need to also bear in mind that people have and will continue to use drugs for a number of reasons. For the simple reason that for some people it feels good, but for other people it's a way of dealing with either serious trauma or experiences of disconnect or, issues of inequality and poverty. Because when you've got nothing, then you really have to look for something to give meaning to your life. And sometimes that's what drugs do. They create a sense of meaning. They help you to deal with the circumstances that you're living under. And so what we're also saying as part of this campaign is if drugs are the solution, what is the problem? And what are we going to do about the problem? It's the problem that we need to be looking at. And often that's not drugs themselves.
Now, Professor, why is the campaign of such significance to South African communities? And I hear you speaking about supporting people who are dealing with a drug problem. But how do then immediate families, friends and communities help support people who are normally shunned in the communities?
Well, it's a real problem because families themselves are shunned when it's heard that, they're members of their families that are using drugs. So, I think part of the problem is that people are unwilling or unable to talk about drugs. And that's the first thing, is we should be able to talk about drugs and say, this is what's going on in my family, and not feel that, that's going to be embarrassing or something that brings shame to your family. So really, the first thing that communities should be doing is allowing people to talk about drugs, whether they're the users or whether they're families. And then families really, the point is that for many drug users, when drug use becomes problematic is when they feel disconnected. And so one way of really helping is to get users to feel that they are connected to a certain person or to an institution or to an organization that really genuinely is concerned about their welfare and their well-being. And then, of course, it's important that government offer their services that are required for drug users to have public access to, which currently families don't have. So that's a real problem because we don't really have the resources for families of drug users to go to, and they feel quite stuck themselves. So part of what we're advocating for today is for the public system, for government, also to roll out harm reduction services. At the moment, it's very much dependent on non-profit organizations and NGOs in the private sector. But of course, that's not very accessible to the majority of people and the majority of communities that are affected by drug use.
Professor, finally, drug users, are people that face a number of problems, which is why they eventually turn to drugs. What other alternative ways of dealing with problems do you encourage that drug users turn to instead of substance abuse?
Well, look, I mean, the point is that, again, it's about saying, okay, how do you connect? How do you connect? That's the key word. How do you connect to other people? And there are a variety of different ways that you can do that. You can do that through recreation and sport and through giving people a chance to work, for example. That's really important, because often when you admit that you've had a drug use problem or you do have a drug use problem, people won't employ you. So that's one thing. The other thing is that drug users who, particularly heroin users, should have access to medication, which allows them to come off the illicit drug, which is heroin. I mean, whether it should be illicit or not is another debate altogether. And to go on to legal medication, which is available, but not in the public service, to be able to normalize their lives. And that's really important. But because they don't have that available to them, it's really very, very difficult. So, yes, you're right. The users do have some responsibility in terms of trying to connect. But it's very difficult when you're marginalized, when you're stigmatized, when you're arrested constantly, when you're harassed by the police, and when you actually don't have any access to the kinds of health services that you really require.
Thank you very much. That was Professor Monique Marks, the head of Urban Futures Centre, talking to us about the scourge and the effects of drugs on South African communities.